Good day everyone. My name is Jasmine Elizabeth Ambahala and I am currently in my workplace. So today we'll be tackling about public health and safety in a time of COVID-19. So today we'll be tackling about, or our group will be tackling about a lot of things. So first off, what is the definition of health in general? And then what is the meaning of public health? And then there will be a brief history of what is public health, or public health, like, you get it, the history of it. And then what is public health today, and then public health and safety at the time of COVID-19, and then the moral challenges of science in the time of COVID-19, and of course there will be a summary at the end of this video. So to start, once again, my name is Jasmine. So we're gonna be looking into what is the definition of health. So in 1948, the World Health Organization, or WHO, first defined health as a state of complete physical, mental, and social well being. So it's not just about the absence of disease. Later on, in 1986, HOW added that health is also a positive concept. So it is not only about being free from sickness, but it is also about having social and personal resources to live a full and meaningful life. So health can be divided into two main types, which is the physical health and the mental health. So first is physical health, which means that the body functions and systems are working well. This includes proper exercise, good nutrition, and enough rest. So, me personally, I believe that I don't have this. I don't have proper physical health well being. How about you? If I'm going to ask you, do you have a proper physical health? Well, then, that's good for you. And then the next type of health is mental health. Of course, we all know about this, but just a brief definition. It refers to a person's emotional, social, and psychological well being. So it is not only the absence of mental illness, but is also the ability to handle the stress, adapt to challenges, and enjoy life and reach their goals. So, aside from those that I mentioned, which is the physical health and mental health, we also have the other aspects such as spiritual, emotional, and financial health. So, according to the book of Science and Technology, people with good spiritual health feel calm, mindful, and have a sense of purpose. And people with good emotional health can understand and manage their feelings better. Also, people with stable financial health worry less because they can meet their daily needs. So, common sense lang. Of course, if you have the financial stability, then of course you can buy the necessities that you need for your daily life in order for you to live a full life. So, as I mentioned earlier, we'll be tackling a lot of things for this video. So, I'm going to giving the stage to the next person. Bye.
Good day, everyone. So, my topic is about public health defined. Public health is different from healthcare. Healthcare treats sick individuals, while public health focuses on disease promoting healthy lifestyles and prolonging life. Charles Edward Winslow defined public health as the science and art of preventing disease and improving life through sanitation, infection control, hygiene, education, medical services, and social support systems. It is also multidisciplinary. Aside from doctors and nurses, it includes researchers, nutritionists, social workers, inspectors, educators, and policymakers who conduct research, promote vaccination, set workplace safety, and even provide a school nutrition programs. A milestone in public health is the 1978 Declaration of Alma Ata, which highlighted that health is a basic right, inequalities in health are unacceptable, and primary healthcare is essential for development and achieving health for all. In short, public health is about preventing illness before it happens and ensuring everyone has access to a healthy life.
Hi everyone. So my part of this reporting is I will explain about history of public health. So let's talk about first about ancient to early modern age. Public health started as early as 2000 BC. There were already water system, toilets, and drainage, which shows that people were already concerned about cleanliness. But during the early modern age, there were no clear testing methods, so it was hard to trace where disease came from. And to 19th to 18th to 19th century, when the Industrial Revolution came, cities became very crowded. This caused poor housing, dirty surroundings, and very disease rates. There were cholera outbreaks from 1820 to 1863, very deadly outbreaks. In London, cholera was even called King Cholera. People used to believe in the miasma theory, which say diseases came from bad air, but John's no proof it was from water. He removed the handle of the Broad Street pump and the outbreak stopped. This was the start of modern epidemiology. Later, Louis Pasteur discovered that diseases are caused by microorganisms. This is called the germ theory. So next, let's talk about the Enlightenment impact. During Enlightenment period, people started using reason ug science na ay si Jeremy Bentham nga nag-push nga sa idea nga ang policy dapat mo-maximize sa happiness ug minimize sa suffering. Ang public health reforms gi-encourage. So the last part of my reporting is about 20th century modern public health. In the 20th century, public health became more focused and organized. The focus was on sanitation, hygiene, and health education. So here are the major achievements included vaccine to stop epidemics, and safe water and food safety, safer workplace and roads, control of infectious diseases, lower deaths from heart diseases, better maternal and child health, reduce tobacco use. So the main goals of public health has become prevention, not just treatment. Thank you.
Good day everyone. Today I'll be presenting about public health today. We'll talk about the challenges public health faces in the 21st century, the framework used to guide it, and why prevention is considered the gold standard. So, public health today faces a number of new challenges. First, we see changing demographics like aging population and urban migration. Second, the digital revolution is transforming healthcare but also creating misinformation. Third, political influence often shape health decisions. And fourth, vested interests from industry sometimes put profit before public health. And lastly, there are new ethical issues such as the right to health for all people. And these challenges show us that we need stronger systems to protect community. So, to address these challenges, the idea of health for all was introduced in 1994, the 10 Essential Public Health Services, or EPHS, were developed as a guide for public health system. These services are grouped into three core functions, which is assessment, policy development, and assurance. This framework continues to guide public health today. So, the first core function is assessment, which focuses on gathering and studying health information. The first essential services is to monitor health status, for example, tracking community health problems like increasing diabetes or dengue cases. And the second service is to diagnose and investigate health problems and hazards, for example, studying the spread of diseases such as COVID-19. And this function ensures we understand health issues before making decisions. And then, the second function is policy development. This is about creating strategies with the help of communities. And the third essential service is informing, educating, and empowering people. For example, anti-smoking corruption campaign. So, the fourth is mobilizing community partnerships like hospital working with schools and local governments. And the fifth is developing policies and plans such as vaccination programs or disaster preparedness. And this function makes sure communities are involved and supported in health efforts. So, the third function is assurance. So, this makes sure health plans are properly carried out and the people actually benefit from it. So, the sixth essential service is enforcing laws that protect health like food safety regulation. So, the seventh is linking people to health services, especially in areas where healthcare is hard to access. So, the eighth is assuring a competent health workforce, so which means training doctors, nurses, and other
workers. So the ninth is evaluating whether the programs are effective, such as reviewing vaccination results. And finally, the tenth is researching and finding innovative solutions to new health problems. And assurance ensures the public health systems delivers on its promises. So the EPHS framework is important because it gives us a clear roadmap for a strong public health system. It addresses complex health problems that involve genetics, environment, and lifestyle. So it also requires many disciplines working together like other programs or other professionals such as medicine, psychology, sociology, statistics, and communication. So public health isn't just one field, it's a teamwork across many fields. So prevention as the gold standard. So prevention is considered the gold standard for public health. Why? While medical treatments save lives, prevention avoids illness in the first place. So prevention prolongs life, improves quality of life, and reduces costs in the long run. For example, teaching children healthy habits prevent diseases before they even started, right? So public health is sometimes invincible. Why? Because it focuses on what didn't happen. For example, it's the heart disease that didn't develop because of better diet, the epidemic that didn't spread because of vaccines, and the outbreak that didn't occur thanks to safety measures like face mask or face shield. So, or the child who didn't get asthma because of the clean air program. So, these invincible successes show the true power of public health. So, in conclusion, public health in the 21st century is everyone's responsibility. It faces many modern challenges but with complex solutions. Prevention and community participation, we can create healthier and longer lives. And public health is more than just curing diseases. It's about building society where people can live meaningful, safe, and healthy lives. So that's all. Thank you. Next topic.
So, good day everyone. My name is Luisa Malino, and today I will be discussing about the public health and safety in the time of COVID-19. So, this topic is important because COVID-19 affected not just our health but also our education, work, and daily lives. And so, let's go through its spread, diagnosis, symptoms and treatments, and also the different vaccines used in the Philippines. COVID-19, also known as coronavirus disease in 2019. So, it is caused by the virus SARS-CoV-2, and it was first identified in Wuhan, China in December 2019 and quickly spread worldwide. This happens when people talk, cough, or sneeze and releasing tiny particles into the air that can be inhaled by others. The spread of COVID-19 becomes even faster in what we call the three C's. So the first, the crowded places where many people gathered and it's hard to maintain distance. The second is the close contact settings such as face-to-face conversations. And third is confined spaces with poor ventilation where the air doesn't circulate well and making it easier the virus to linger and affect others. That is why health experts strongly advise physical distancing, wearing masks, and ensuring proper ventilation to prevent transmission. Now that we know how COVID-19 spreads, let's move on to how it is detected. So to confirm if a person has COVID-19, there are two common tests. So the first is the molecular test, also known as PCR or NATS. So this test detects the virus genetic material using samples taken from a nasal, throat, or saliva swab. It is considered the most accurate test, but it is usually takes longer to get the results because it is requires laboratory processing. So the second one is the antigen or rapid test. So instead of looking for genetic material, this test detects viral proteins or the body's immune response. So the advantage is that the results come out quickly, often within minutes. However, it is less accurate compared to molecular tests. So these two testing methods became very important during the pandemic because they help identify infections early and prevent further spread. The next important step is to recognize the symptoms of COVID-19. The most common symptoms include fever, cough, tiredness, and the loss of taste or smell. So these are the usual signs that make people suspect they might be infected. However, there are also less common symptoms such as the sore throat, body pain, diarrhea, skin rashes, and even red eyes. So these symptoms may be depending on the person's immune system and overall health. So when it comes to treatments, there are antiviral medicines like Paxlovid from Pfizer and Lagovrio from Merck, which helps reduce the severity of the infection So for more serious cases, monoclonal antibodies such as bebtelovimab are used to help the body fight the virus and more effectively. So these treatments combined with early detections, so it played a very big role in saving lives during the pandemic. So aside from the treatments, one of the biggest breakthrough in fighting COVID-19 was the development of vaccine. In vaccination became the most effective way to reduce severe illness, hospitalizations, and deaths. So here in the Philippines, the FDA approved several vaccines for emergency use. So one of the first was Pfizer BioNTech, also known as Comirnaty, so which is an mRNA vaccine. So this type of vaccine trains our cells to recognize and fight the virus effectively. Another one was the Oxford AstraZeneca vaccine, so which uses a viral vector technology. So this method introduces a harmless virus that carries genetic material from the COVID-19 to trigger our immune response. Next is the Sinovac vaccine, also called as CoronaVac. So it is an inactivated virus vaccine. This means it uses a killed version of the virus to safely build immunity without causing disease. These vaccines gave people hope during the pandemic and played a huge role in protecting communities across the country. Next is we have Sputnik V, a viral vector vaccine from Russia. So it uses a harmless virus to carry genetic material from COVID-19, which helps trigger an immune system response in the body. Next is Johnson, also known as Johnson and Johnson. So what makes this vaccine different is that it only requires a single dose to provide protection, making it very convenient, especially in areas with limited access to healthcare. We also have a Covaxin or BBV152, which is an inactivated virus vaccine from India. And this means the virus is killed or inactivated, so it cannot cause disease. But it still trains the immune system to fight the infection. So another one is Moderna, also known as Spikevax. Which is an mRNA vaccine. Like Pfizer, it teaches the body to produce a harmless piece of the virus spike protein, allowing the immune system to recognize and fight the real virus if exposed. Lastly, we have Sinopharm or BIBP, an inactivated virus vaccine from China. So just like Sinovac, it uses the killed virus to build immunity safely. So even though this vaccine use different technologies, whether mRNA, viral vector, or inactivated virus, they all serve the same purpose to protect people by strengthening the immune system against the COVID-19.
The epidemiology triangle shows how diseases happen. It has three parts. The first one, host, second, agent, and third, environment. The host is the person or animal that can get sick. The agent is the cause of the disease, like a virus, bacteria, or parasite. The environment is everything around the host that affect disease, like crowded places, dirty spaces, or bad weather. This triangle helps us understand why diseases happen, how to stop or slow them. A disease happens when a host, an agent, and the environment come together. The host must be weak or easy to get sick. The agent must be strong enough to cause illness. The environment must help the disease spread, like being crowded, dirty, or unsafe. When all three are present, disease spread quickly. For COVID-19, the host is anyone who can catch the virus, especially people with weak immunity or health problems. The agent is the SARS-CoV-2 virus, which spreads easily. The environment includes crowded places, poor ventilation, or areas that are not clean. When a weak host meets the virus in a bad environment, COVID-19 spread fast. Disease spread less when one or more sides of the triangle are controlled. The host becomes stronger by getting vaccinated, eating healthy, and staying active. The agent spread less if sick people stay home or wear masks. The environment becomes safer with clean spaces, hand washing, and proper ventilation. For COVID-19, controlling any of these sides lowers the chance of getting sick. Even if the virus is around, strong host defenses or a safe environment reduces the spread fast when all three sides are strong. The host is weak, the agent is strong, and the environment helps the disease. breaking any one-side weekends or stop the disease. For COVID-19, this means vaccinating people, isolating sick individuals, using masks, and keeping areas clean. The triangle helps us know what actions work to reduce disease and protect people.
The pandemic showed us what our health system are good at and what they need to improve. It is also give us a chance to create better system for the future. Scientists must think about more than just finding answer. They must also think about fairness, honesty, and helping people who are the most affected by the pandemic. Science is not just about finding new things, it is also about doing the right thing. During the pandemic, scientists had to balance their work with their duty to protect people and make the world better. As we move forward, let's remember the lesson of the pandemic. Let's make sure science always helps people. That is by the guided fairness, care, and a shared goal for a healthier, more equal world.
COVID-19 pandemic creating many challenges for the scientist community. First, travel restriction enforce scientists to collaborate remotely, while access to open data become limited, affecting both public and private research. Scientists also need to engage more with media and improve science communication to share accurate information with the public. Finally, cuts and economic struggles reduce funding, while social media created both opportunity and risk for spreading knowledge. Furthermore, the crisis emphasized the importance of infrastructure, resources, and international collaboration, interdisciplinary approach were engaged to solve complex problems. However, issue of pandemic freedom or integrity arose, especially when inconvenient truth risk being silenced. Finally, scientists has to balance curiosity-driven research which focus on long-term knowledge with mission-driven research, which aims to short-term thought. Overall, the pandemic highlighted the science must be socially responsible, collaborative, and adaptive to build a better and safer future.
So hello everyone, my name is Heidi Tambana and now we'll be talking about the summary of the Section 3. So the Section 3 reviews the public health crisis, focusing on the causes, spread, and prevention of the diseases, as well as the moral and ethical challenges brought by the COVID-19 pandemic. So the public health and safety in the time of COVID-19. In this report, we emphasize the importance of public health and safety during a global crisis. As mentioned earlier by my group mate, this topic talks about the action we must take to prevent the spread of the virus, how to protect our communities, and ensure the well-being of everyone. These efforts are essential in keeping us informed, prepared to face challenges both and during the pandemic. Public health focuses on the protection and promotion of health of the entire populations. As what you have heard to the other reporter earlier, we also tackle different health perspectives, and these perspectives help us to guide the communities toward overall wellness by promoting prevention, adaptation, and access to care.
So, hi, I'm back, and that is the end of our reporting. So, I hope you guys learned something from this about public health, especially during the COVID 19. So, again, we are the group 3, and this is public health during the COVID 19. Thank you so much. Have a great day. Bye.